Now, another really great article is omega-3s and omega-6s. This is an article from 2011. And it was the impact of omega-3s to omega-6 polyunsaturated fatty acid ratio on cytokine release in human alveolar cells. Okay, this is over 10 years ago. So
cytokine release.
So you're talking about inflammatory response when somebody gets a really bad pneumonia, bad infection. And that's particularly prevalent given the pandemic.
Yeah, I was just going to say.
And cytokine storm. But in this case, the short of this one was if subjects had a ratio of 1:1 or 1:2 of omega-3s to omega-6, then they did not have a big inflammatory response. They did not have excessive cytokine release. But when you went up to ratio of 1:4, 1:7, a larger proportion of omega-6, then you get a lot more inflammatory damage with an inflammatory stimulus. That was basically what this paper was. And, persistently elevated levels of pro-inflammatory cytokines associated with decreased production of anti-inflammatory cytokines correlate with severity of lung injury. The degree of cytokine imbalance leads to additional non-pulmonary organ dysfunction and increased mortality rates in ARDS patients. ARDS, you've heard of ARDS, acute respiratory distress syndrome.
That became popular during COVID.
Yeah. So you diagnose ARDS with often clinically with an X-ray, with a blood gas, with just how the patient looks.
Right.
You have to make decisions.
So you're saying, like, just as a complete layperson almost, the cytokine storm we saw after infection like COVID, right?
Yeah, and it doesn't have to be COVID. It could be any pneumonia.
Anything in the lungs. Are we seeing a similar thing happening because of the diet we're having in other organ systems? Same kind of response?
I didn't find any papers on the cytokine release in other organ systems.
Okay.
But typically cytokines can overflow and leak into other organ systems. That's certainly possible.
Okay.
But this is important because what you folks need to take away from this is that you invest in your health. You invest in your health by paying attention to things like this, by understanding that the food industry does not understand this, and the food industry is not interested in healthcare outcomes. They're interested in making money.
Of course.
And that's just kind of the way it is right now.
So the ratio of 3 to 6,
So
you need to have solid omega-3s. The more 6s you ingest, the more omega-3s you need to have.
Exactly. And all these academic institutions will say you can have a little bit, but do they actually come out and give you a clear example of what you should do?
No.
Rarely, if ever. And then there's dietitians on academic websites that are saying that margarine's good for you. Okay, we're going to talk about margarine, folks. We're going to talk about margarine in a little bit.
I'm a fan of Kerrygold grass-fed butter.
Kerrygold, it's a good brand, especially like the whipped, like the softened up. Oh yeah, that's great.
Would that be omega-3?
Depends. Depends on what the cows were fed.
Grass-fed.
If it's 100% grass-fed, then there should be a good amount of omega-3s in there.
They play games with that too.
Yeah, so this is another big problem. This is where we have scientism versus actual, we could say godly science, like a science that can be trusted because we have this devotion to a principle, not, just make this study look good so that we can sell more.
Right.